Identify the foramina visible in the base of the skull. Beginning anteriorly, find the incisive fossa leading to the incisive foramina, which transmit the left and right nasopalatine nerves. Moving posteriorly and laterally, identify the greater and lesser palatine foramina, through which the greater and lesser palatine nerves and vessels pass. Then find the large choani or posterior nasal apertures, which lead from the nasal cavities to the nasopharynx. Find the vomer, the bone which separates the two nasal cavities and forms part of the nasal septum. Moving laterally, identify the foramen ovale, an oval foramen that transmits the third division of the trigeminal nerve, the mandibular nerve, and the lesser petrosal nerve. Immediately adjacent to the foramen ovale, note the foramen spinosum, which transmits the middle meningeal vessels. Medial to these two foramina is a jagged opening, the foramen lacerum, which is closed by fibrocartilage. Lateral to the foramen lacerum, identify the carotid canal, through which the internal carotid artery passes to reach the cranial cavity and the brain. Just anterior to the carotid canal, find the groove for the auditory tube, which runs from the nasopharynx to the middle ear cavity. Anterior and medial to the mastoid process, locate the stylomastoid foramen, which transmits the facial nerve. Just superior to the occipital condyles are the hypoglossal canals, which can't be seen in this view, through which travel the hypoglossal nerves, cranial nerve 12. Posterior to the condyles, identify the condylar canals, which transmit emissary veins from the sigmoid sinus to the vertebral veins. These are often confused with the hypoglossal canals, but note that these foramina open posterior to the condyles. Lateral to each condyle is the large jugular foramen, which transmits cranial nerves 9, 10, and 11, the distal end of the inferior petrosal sinus, and the confluence of the sigmoid sinus with the internal jugular vein.